Assalamualaikum warahmatullahi wabarakatuh. We from Group 2 will present you our project about the production of erythropoietin as biopharmaceutical product from Chinese hamster ovarian CHO to treat anemia disease. My name is Amirul Zarif bin Anwar and now I will tell you about the introduction of production erythropoietin as biopharmaceutical product. Erythropoietin, commonly known as EPO, is a glycoprotein hormone that plays a crucial role in the production of red blood cells. Naturally, it is produced by the kidney in response to hypoxia or low oxygen levels. In the realm of biopharmaceutical, EPO is synthesized using recombined DNA technology in Chinese hamster ovary or CHO cells. The significant EPO in medicine cannot be overstated. It is essential for treating anemia, particularly in patients with chronic kidney disease, cancer, or those undergoing chemotherapy. The introduction of recombined EPO has dramatically reduced the need for blood transfusion and has significantly improved the quality of life for these patients. Our project aims is to produce erythropoietin, a biopharmaceutical product derived from Chinese hamster ovary CHO cells for treatment of anemia. The production process of recombinant EPO involves inserting the human EPO gene in two cells, culturing these cells in bioreactor, and then purifying the EPO from the culture medium. This method, approved by the FDA in 1989, marked a major milestone in biotechnology, leading to the development of multiple forms of recombinant EPO, then enhance efficacy and reduce side effects. So now, let's go into the mechanism of how erythropoietin function in the body. This flow diagram illustrates the mechanism of erythropoietin. First, the process begins with the detection of hypoxia or low oxygen level by the kidney. In response, the kidney produces and releases erythropoietin in the bloodstream. Erythropoietin then travels through the blood and binds to the receptor on hematopoietic stem cells in the bone marrow. This binding activates the JAK-STAT signaling pathway. The activation of this pathway leads to the production of red blood cells, a process known as erythropoiesis. Finally, the increased number of red blood cells improve oxygen delivery to tissues and organs, effectively alleviating the hypoxia. This biological feedback loop is critical for maintaining adequate oxygen level in the body and is the foundational principle behind the therapeutic use of recombinant.
Hello, my name is Muhammad Azimran, and today I will present about the current scenario of the anemia treatment, which is EPO. And I will present about the delivery, following Alia for the formulation, and also Nasrid Aiman for the manufacturing. So there are currently two methods for the delivery of the EPO, which is first is subcutaneous, is injection under the skin, usually in abdomen, thigh or upper arm. The delivery is injected into the fatty tissue, while the absorption are slow and gradual, and benefit is less painful. So next method is intravenous, which is injection site is directly into the vein, usually arm or hand. Delivery inserted into the vein, the absorption are fastest as and most direct. Benefit is a self-administration possible with training.
Current scenarios for formulation. So the first one is the Chinese hamster ovarian cell line, which is the formulation is taking the culture for 3 days with the 10% fetal bovine serum, and it is cultivated with penicillins and streptomycins, which hundreds microgram per ml for each, and it's incubated for 37 degrees, and it is same as the erythropoietin productions. We cultured for 3 days from the journals. Then it is incubated for at 37 degrees Celsius for 48 hours. So the third formulation is the erythropoiesis simulating agents. So there are two types, which is erythropoietin alpha and erythropoietin alpha. This two type is basically used in widely used. Yeah. So I will continue to the next presenter.
Okay, my name is Raiman. I will explain about the current scenario for manufacturing of EPO. For the first step is the recombinant DNA technology is utilized in EPO production. From that, we developed RHU PO. For the next step is uh, improvement in production quality and control. Then it will undergoes to treatment of anemia in the patient. Lastly, it will impact on the patient quality of life.
Problem statement with the current practice. So for the problem statement of the both current method, which is subcutaneous and also intravenous, which is first is for the subcutaneous is low due to the frequent injections from the patient compliance, and then for the off-target effect, both risk of unintended effect in non-target tissue and lower risk compared to the subcutaneous. Next is vascular access failure. Um, both increased risk compared to intravenous, while intravenous is lower risk. For hypertension, it require close monitoring and control due to the potential of the control high blood pressure. While for intravenous is similar risk and close monitoring required. For the systematic side effect, uh, it is a lower risk compared to the intravenous. Is a high serum level needed to efficacy can cause the hypertension and increase the blood clot risk. For the hematological complication, subcutaneous are lower risk, while the intravenous risk of excessive red blood cell production, increasing the vascular complication. And lastly is toxicity is subcutaneous is lower risk, and also for intravenous, if elevated EPO level might cross the blood-brain barrier and potentially affecting the neurological function.
Current problem statement for the current scenarios. So the first is I will state for erythropoiesis stimulating agent, which is the comparisons of erythropoietin alpha and derivapoietin alpha, which is it shows that erythropoietin alpha has a low certainty in many terms of chronic diseases such as heart failures, kidney failures, and fatigues and everything. However, the derivapoietin alpha, compared to the daprodustat, it is non-inferior formulations comparisons, and daprodustat is more more useful than derivapoietin alpha.
Okay, now I will explain on the problem statement or current practice of manufacturing of EPO. There are four problem statement, which is high manufacturing cost to produce EPO, then restricted availability of EPO analogs and biosimilars, then recombinant DNA technology. Lastly, it strongly relies on the utilization of ingredient produced from animal.
Propose innovation based on the problem statement. Regarding on the problem statement, so they have a proposed idea based on the delivery. First is method is micro needle patches. So this patch replace the injection with tiny needles that painlessly pierce to the skin. These patches are coated with EPO medicine that get released slowly over time, and they are typically made of safe material for the skin. And then how it's work is first the patch with microneedle is applied to the skin, and the needle create a small opening in the skin. EPO medicine from the patch get delivered to this opening, and the medicine enters the bloodstream and helps the body produce more red blood cells. So benefit of microneedle is it painless compared to injection, and more medicine gets absorbed by the body, and medicines can be released slowly over time. So for the next method is oral delivery of erythropoietin. erythropoietin. So it involves taking EPO by mouth, bypassing the need for the injection. This method used for liposomes, tiny lipid particles to encapsulate the EPO and release it slowly. The liposomes are absorbed through the intensor wall and release EPO into the bloodstream to stimulate red blood cell production. So this process involves several steps, which is absorption. EPO must be absorbed through the gastrointestinal tract, which is difficult due to the enzyme that can break down the protein. Next, digestion. The enzyme in the stomach and small intestine digest EPO into the smaller peptides and amino acid, reducing its bioavailability. Third is processing in the liver. The absorbed EPO is further broken down in the liver before being released into the bloodstream. And last is the distribution of the EPO, then travels to the bloodstream, binds to the receptor on red blood cell and stimulates their production. So it also have challenges, which is low bioavailability. That's the digestion and processing reduce the amount of EPO that reach target tissue, and also the degradation since the enzyme and pH can change in the gastrointestinal tract and degrade the EPO. So for the last method is intranasal administration of EPO. It delivers the EPO directly into the nasal cavity, bypassing the need for injection. This method is effectively delivers EPO to the brain and other tissues, stimulating the red blood cell production and providing the neuroprotection. The mechanism is bypassing the blood-brain barrier (BBB). EPO is delivered to the brain to olfactory pathway in the nasal cavity, which are connected to the brain via the olfactory bulb. This allows higher concentration of EPO to reach the brain. So the brain uptake international delivery achieve a brain uptake more than 5 times higher than systematic administration, providing a rapid therapeutic concentration in the brain. So the benefit in a it is a rapid delivery, quickly delivers EPO to the central nervous system, CNS. Neuroprotection of a EPO help protects against acute ischemia in the CNS by inhibiting the glutamate overproduction and inflammation and also oxidative stress. Also improve permeability, increase BBB permeability for more efficient brain delivery. Non-invasive and effective is minimize the systematic exposure and reduce the risk of side effect.
We'll continue with the proposed innovation for formulation. So the first one is the liposomal delivery of erythropoietin. So it enhances the bioavailability and efficacy. So it's all to target the specific tissues or cells, the liposome, and it enhances its stability and shelf life. So the second one is the erythropoietin's receptor targeted delivery. It is quite similar to the liposomal delivery of erythropoietin, but however, it used the tamoxifen loaded nanostructural lipid carriers, TLNLC. It target the erythropoietin receptor on breast cancer cells. So it is used for erythropoietin for anemia, and it's reducing the needs of frequent injections. Also, it's improved the patient's compliance.
So the proposed innovation part in manufacturing of EPO, there are two proposed innovation, which is additive manufacturing (AM) technology for EPO production. It utilizes 3D printing in EPO production. Then it reduces the cost by eliminating the need for expensive raw materials. Lastly, it allows for the creation of personalized EPO molecules for specific patient. Lastly, it significantly shorten production time. The next proposed innovation is single-use bioreactors. It designed for single use. It eliminating the need for cleaning and sterilization between uses. Lastly, it reduces overall production costs and contamination risk.
Identification of conflicting requirement in the drug development. So for the conflicting requirement based on the three previous method is first microneedle patches, EPO stability, maintaining the EPO coating stability during fabrication is high temperature and humidity. So biocompatibility, choosing the safe material can affect the overall batch biocompatibility. Contamination prevention, the sterilization and handling are crucial to prevent contamination. So last is effective delivery. The efficiency depends on microneedle design, EPO type, and also the patient skin type. Next is intranasal delivery, balancing effects, achieving the neuroprotection without stimulating red blood cell production, and also local adverse event, because of minimizing side effect like itching, headache for patient comfort and safety, and thermobolic risk, reducing a blood clot risk while maintaining treatment effectiveness. Bioavailability, pharmacokinetics, optimizing drug absorption and movement for efficiency, can minimizing the side effect. So for the oral delivery, EPO stability, maintaining EPO stability during a formulation, absorption efficiency, enhance the can damage the intestinal cell and break down the EPO. Systematic exposure lower bioavailability, reduce side effect but might affect the treatment efficacy. And lastly, regulatory compliance, meeting safety, efficacy, and quality standard is complex and expensive.
For the conflicting requirements in the drug developments, I have identified the formulations for liposomal delivery of erythropoietin and erythropoietin receptor targeted delivery. Both of it requires a high cost for productions and manufacturing, and formulation too. Second thing is for the liposomal delivery of erythropoietin. It has a short half-life, which can cause the risk of it has a potential risk in the future. And the third one for liposomal delivery of erythropoietin is it has low solubility, so the formulation needs to have a long um, research for the solubility things. And then for the erythropoietin receptor targeted delivery, it increased the clinical trial phases as it is um, taking a longer time, as it is need to be having more research and trials, and then it is needed to have a lower doses for efficacy, because the high doses it will not get the targeted therapeutic treatment. And the last one, it will become more complex, and maybe there will be a new type of delivery method since it requires only erythropoietins for anemia treatment.
Now, identification of conflicting requirement for the manufacturing of EPO. There are four types of conflicting requirement, which is technical requirement, which is precision and control, and bioreactor configuration. Next is engineering challenges, which is the bioreactor design and efficient elimination. For the third one is environmental concerns, which is waste generation from the production and environmental sustainability. Lastly is safety concern, which is contamination risk and contamination mitigation.
Consequences of the development of product, process to the society and also to the environment. For microneedle patches, impact on society is easier treatment, no needles, more effective treatment, more people can use it themselves, lower healthcare costs, better quality of life. For environmental, it less plastic waste, biodegradable microneedles, more recycling, less energy use, positive impact on the environment, reduce the intervention. As for the international EPO, the impact is on society, better treatment for brain disease, usually on Alzheimer, Parkinson, easier access to care in remote areas, low healthcare costs, improved memory of and thinking, advanced brain research. For environmental, more energy used to make them, creates more waste, usually on packaging applicator, extracting material can harm the environment. Chemical use in production might pollute and lots of waste end up in landfills. And lastly, on the orally EPO, impact on society is easier treatment for anemia. More people can access treatment, lower healthcare costs, and treatment option for other disease, but it also can potential for the abuse. For the impact on environmental, more water used in production creates more waste. Packaging medicine use more energy to produce, like resources from the earth. Lots of waste end up in the landfills and pollute air and water.
Every drug has its consequence of the developments towards the society and environment. So for the society, the first one is it improves the quality of life for every anemia patients, and it's increased the energy level as it enhance the production of red blood cells. It's also reduced the transfusions of blood and lesser the problematics of transfusions of blood, and however it has a high cost with a quality product, as the product will have more high cost for manufacturing and development, so it will make the product will be more costly. Yeah. So for the second thing is for environmental. Erythropoietin drugs is basically using components of biodegradable. So but however, if it is not it is managing improperly, so it could generate the leach. And to overcome this, life cycles assessment for erythropoietin formulation is needed. So it could help in the process of environmental footprints, and to overall impact, the energy consumption should be lesser. I will pass to the next presenter.
For the manufacturing part, in the consequences of the development, which is in this part is additive manufacturing technology in EPO manufacturing, focusing on society. We have improved healthcare outcome and reduced disparities. Next is economic growth and employment opportunities. For the next point is it enhance patient outcome with customizable implant. Next is cost effective production and healthcare expense reduction. Lastly, innovation and research stimulation. For the environment part is reduce material waste. It also energy efficiency. Is you use sustainable material. Second last is minimal chemical additive. Lastly is recycling potential. For another proposed innovation in manufacturing, which is bioreactor in EPO manufacturing. For the society part is improve healthcare outcome and reduce disparities, economic growth and employment opportunities. It enhance patient outcomes. Next is cost-effective production and healthcare expense reduction, and innovation and research stimulation. For the environment part, it reduce material waste. It the bioreactor also energy efficiency, and it use sustainable material. Second last is minimal chemical additive, and lastly recycling potential.
In conclusion, the production of erythropoietin from Chinese hamster ovary cell represents a significant advancement in the treatment of anemia. Innovative biopharmaceutical techniques such as enhanced EPO production through the supplementation of CHO cells with a specific protein domains show great promise in improving yields and efficacy. Additionally, advancement in drug delivery systems like controlled release implants and nanoparticles aim to improve patient adherence and reduce the frequency of injection. This innovation not only enhance patient outcome by offering personalized treatment option and better health quality, but also make EPO treatment more accessible and cost effective, especially in developing regions. Furthermore, the move towards more sustainable manufacturing process is expected to reduce the environmental footprint of EPO production, aligning with global sustainable development goals. The development of efficient and scalable manufacturing process can contribute to the reduction of healthcare costs and improve the overall quality of patient care. The ongoing research and development in EPO production underscore the importance of continuous innovation to overcome current challenges and limitations, ensuring that this crucial therapy become more accessible and beneficial for patients worldwide. As we continue to refine this process, the future EPO treatment looks promising with the potential for significant social and environmental benefit. So thank you for your attention.